In this video, I will cover types of anemia. Anemia is a condition where there are not enough healthy red blood cells in your body to carry oxygen to your organs and tissues. One test that can help to diagnose anemia is the hematocrit, which measures the volume of plasma in cells. Since red blood cells represent most of the cell volume, a low hematocrit indicates a low number of red blood cells, which indicates anemia. Let's begin with iron deficiency anemia. Iron deficiency anemia is the most common type of anemia. It is caused by a lack of iron in your body, which is needed to make hemoglobin, a protein in red blood cells that carries oxygen. Here we see fewer red blood cells that are more transparent than normal cells due to the decreased hemoglobin. Iron comes from food sources like red meat, poultry, fish, beans, and leafy green vegetables. Pernicious anemia results from a deficiency in B12 or folic acid. These substances are needed to make red blood cells. In pernicious anemia, red blood cells are larger than normal because they are immature. You can get vitamin B12 from food sources like meat, fish, and dairy products. Hemolytic anemia is a type of anemia in which the red blood cells are destroyed or removed from the bloodstream faster than they can be replaced. Hemolytic anemia can be caused by a variety of factors, including inherited genetic disorders, infections, autoimmune diseases, certain medications, and toxins. Inherited genetic disorders that can cause hemolytic anemia include sickle cell anemia, in which red blood cells have a sickle or half-moon shape, thalassemia, that affects hemoglobin production, and hereditary spherocytosis, in which the red blood cells have a spherical shape instead of the usual biconcave disc shape. The abnormal shape makes these cells more susceptible for destruction by the spleen. There is also Diamond-Blackfan anemia, which is a rare type of anemia that affects children and is caused by a genetic mutation that inhibits the production of red blood cells by the bone marrow. Aplastic anemia is a rare and serious type of anemia in which the bone marrow fails to produce enough red blood cells. When the bone marrow is damaged, it can't produce enough blood cells to meet the body's needs, resulting in anemia. Aplastic anemia can be caused by a variety of factors, including autoimmune disorders, exposure to certain chemicals or toxins, radiation and chemotherapy treatments, certain medications, and viral infections like hepatitis and HIV. Treatment for aplastic anemia depends on the underlying cause and severity of the condition. It may include medications, blood transfusions, bone marrow transplants, or immunosuppressive therapy to suppress the immune system and allow the bone marrow to recover. Symptoms of anemia can include fatigue, weakness, shortness of breath, pale skin, jaundice, low blood pressure, enlarged spleen, infections, changes in stool, rapid or irregular heartbeat, and frequent infections due to a weakened immune system. I hope you have learned about anemia. Thanks for watching, and see you next time.